Anna, if you want to go ahead and start off to just give us a little bit more information about you and what you're about.
Sure. Hi, everyone. First of all, I wanted to thank you, Casey, for inviting me to be a part of this. This is very, very special. And I'm so honored to be in this group with Tiara and Mariana, two people that I admire very much, that I have worked with in the past through our work in diabetes. But this is the first time that we've done something together. So this is very exciting. As you mentioned, my name is Anna Norton. I'm a Cuban-American woman that lives with type 1 diabetes. I was diagnosed 27 years ago, and I live outside of Chicago with my husband and my son. Professionally, I'm the CEO of Diabetes Sisters, which is a nonprofit organization whose mission is to provide support and education for women that live with any kind of diabetes, both online and in person.
Awesome. Thank you so much for being here. Mariana, do you want to share a little bit more about you?
Yes, thank you. First of all, thank you for having me here. This is my first panel in English. Thank you very much. And it is a pleasure to share this window with Tiara and Anna, with whom I've worked for a long time now. And it is an honor to be here. So thank you very much for the invitation. My name is Mariana. I am a psychologist and diabetes educator, born and raised Mexican. And nowadays I live in LA. I've only been here for a year now, which is very exciting and interesting. And I've been working in the diabetes space perhaps since 2006, when I became a diabetes educator. I was diagnosed with type 1 diabetes in Mexico City back in 1984.
Okay, thank you so much. Tiara, do you want to go ahead and share a little bit about you?
Yeah. Hi, everyone. I'm Tiara Smith. I've been living with diabetes since 2017. I was diagnosed at 25, misdiagnosed with type 2 diabetes, only to get the right diagnosis a little over a year ago in April with type 1 LADA. My background is in nutrition education, and professionally right now I work at Beyond Type 1, overseeing Beyond Type 2, which is a platform for people with type 2 diabetes who are looking for practical resources on how to live well with the disease. And we also take pride in dismantling stereotypes about the disease. I'm very happy to be on this panel with both Mariana and Anna, two women who I really admire, and they are pioneers in the diabetes online community and just the diabetes industry in general. So it's really an honor to be on this panel with them.
Amazing. Okay, so Mariana, do you want to go ahead and start off and tell us what you think that the biggest struggles and issues people who speak Spanish face, you know, trying to find resources with diabetes?
First of all, I'd say, as per my personal experience, language is perhaps the strongest barrier for us Spanish speakers here in the United States. We have to understand that translating is not always enough, because there are cultural aspects and emotions and other details and specifics that our population needs. So most of the times, language is the first struggle that we are facing. And secondly, the cultural aspect of living with a condition like diabetes, and the communication that we have with our healthcare professionals and the way we speak diabetes is different among different cultures and races and places and countries. So finding a space for us as a Latino population is really complicated, because it's not only one country we're talking about, it's different countries with different characteristics, like very different ones. So we have to remember that we are not all the same, but that we have to address all these cultural differences and make sure that we address them all. So it's perhaps, those are perhaps the strongest barriers that I have faced so far.
Yeah. Anna, do you want to add a little bit more about that and your experiences?
Yeah, well, I love that Mariana mentioned that culture thing, you know, because yes, we're all Latinos, right? We're all Hispanic, we all speak Spanish, but our cultures can be a little bit different. It's very nuanced, right? So what is really common for Mariana in Mexico is very, very different for my family in Cuba. you know, even things that we eat. And so I think that that's really important when we talk about culture and diabetes and being underserved communities, that we talk about the things that are very, very specific to us. You know, I wish that early on in my diabetes education, I had learned about, you know, eating rice and beans, right? Whereas for Mariana, it's probably something like tortillas, right? Something like that, something that my culture doesn't see, something that we're not familiar with, you know, and that an educator to me would have said, oh, well, you're Hispanic, so let's talk about eating, you know, tortillas. And I'd be like, well, I don't eat that, you know, I've never had that before. So I think that that's really, really important to have that understanding of the nuances within one culture.
Yeah, and you really have to find, I mean, resources within your own community who really understand what you guys are going through, and that you can really trust and know that, well, they've lived through this experience, so I'm going to trust them more than, you know, what a textbook may tell me or something like that. Tiara, do you want to talk a little bit more about what you think the community plays a role into helping people find resources for themselves with managing their diabetes?
Yeah, absolutely. So community is a place that you can call home to an extent, especially if it's a community that you can find online. I find that sometimes living with diabetes can be really lonely, even if you know people in your own lives who have experiences with it, and that's just because there's a lot of stigma surrounding it. I think I can, you know, as a Black person with diabetes, there are a lot of jokes that people I know who know about diabetes but don't know that saying something like, hey, you're gonna get your foot cut off is pretty insensitive and actually quite scary. Or even if we're thinking about like weight stigma, I'm not a skinny person, so I've also heard the jokes of like, oh, maybe you should put this down, maybe you shouldn't eat that, can you eat that? So it makes it hard to open up about my experiences in person. However, online, I know that there are people who are looking for the same things I'm looking for. So if I can go to a Facebook group or an Instagram where someone says, hey, this is where I've learned about soul food and diabetes, I know that's a place for me because I can openly say, hey, I don't want to give up some of the things that I've grown up eating, but I still want to make sure I'm taking care of myself. I think for me, one of the first places that I went to, other than ADA, the ADA website, was Women of Color Diabetes. And it was the first time where I had seen other women of all ages who look like me have a space for me. So it made me more encouraged to go seek out other resources to bring to the table there. And unfortunately, I had the opportunity to meet the lovely woman who runs that website. But I think community can be a really great place to find resources. It's a place where people can share their own experiences. They can send you links where you've never probably heard of a new organization before. They can share recipes and how you can still eat your favorite foods. They can talk about exercise, body image, mental health, whatever you're looking for. So I think that's the role that community plays, and it's really important if you can learn from that from someone who looks like you or has a similar experience as you too.
Yeah, for sure. I've heard someone say community is the cure for right now before there's a cure. But yeah, I definitely have liked that saying so far. Anna, do you want to speak a little bit more about Diabetes Sisters and the resources y'all have available?
Yeah, so I'd love to. So so Diabetes Sisters has been around since 2008, but it wasn't until about 2016 where we introduced a minority initiative program where we really wanted to focus more on underserved communities. And so we started with African American women and Hispanic Latina women, and brought some programs to specific areas in the United States. We had been doing a lot of in-person programming, support groups, you know, non-judgmental, but we felt that we needed to do a little bit more. And so we started with a program in Silver Spring, Maryland, and we just brought resources like Tara was talking about. It was, we worked with a health ministry, an African-American health ministry outside of Washington, D.C., and we said, what do you need? And they said, we just need information. We don't know anything about diabetes. So we showed up, we brought some information about Diabetes Sisters, about peer support, someone from the CDC, we brought an endocrinologist, we brought a cardiologist, and we just said, like, why are you here? And women started getting up and saying, I was diagnosed with prediabetes and my doctor told me to come back in a year. And we said, okay, so you're here. And they were, yeah, we're here because we don't want to go back in a year, because what's going to happen a year from now? And we don't know what we're supposed to eat, and we don't know who we're supposed to meet with, and what our healthcare team should look like. And so that's really eye-opening to us to hear that, right? Because the expectation is that we're going to get quality healthcare. And so what we were seeing was that culturally, doctors were saying, just come back, you know, like it's not a big deal. And these women knew that it was a big deal. You know, so then we extended our program to South Florida, where we just do strictly programs in Spanish. A lot of conversations on nutrition, on cultural eating. We have a great diabetes care and education specialist who sits on our faculty, and she has these really great photos of plates. And so she has a photo of like what a Puerto Rican plate looks like, what a Mexican plate looks like, what a Cuban plate looks like, what a Colombian plate looks like. And she really discusses what those differences are and talks about, you know, what a good carbohydrate is, and, you know, which one has a different kind of glycemic index and will raise your blood sugar in a different way. She talks a lot about fiber. And so those things have been really important in teaching people with diabetes culturally. They're learning from somebody that looks like them, someone who's reputable, who has like those letters after their names, who speaks their language, you know, has that personal touch, but that person is teaching them something today and they can put it right into practice tomorrow. And that's really, really important, especially when we talk about culture, you know, that we're not being thrown a lot of information and our family is not being inundated with too much.
Mm-hmm. I want to piggyback off what Anna just said just now, but like the practicality of resources really matters. I think sometimes when it comes to educating people about diabetes, people try to throw like a lot of like highly technical terms and a lot of things that are talked about in abstract, especially if there are things that aren't as accessible to you. But honestly, the basics are fine. And that's what we're really, really looking for. What is the most basic of basic things that we can use to apply to our own lives? And you can get that in communities.
And I'm going to piggyback now off of Tiara. Like that basic empowers us to ask more questions, right? So if we're given those basics and we understand them right away, culturally, and we can explain them to our families culturally in a really simple, concise way, then we can go back to our healthcare team and ask them more questions the next time. Mm-hmm. You know, and that empowerment means so much, right? Like Tara, you mentioned something about like you want your healthcare provider to speak to you respectfully, right? And that's all part of that too, because we don't want to be lectured. There's all of these different things that we talk about when it comes to diabetes, but culture across the board plays such a big part in the reaction of people with any kind of chronic illness.
Yes, exactly. And like I've one of the things that we always want to know about is like food. Like food is a language itself, and we're so connected to it. And depending on your culture, you share everything over a really good meal. And sometimes you can feel excluded if you can't participate in that with your friends and family because you're worried about diabetes, or sometimes you're willing to take the risk and continuing with those habits that may lead to complications in the long run. So it's really, really important to make sure that when you're talking to someone, talking to them respectfully, but also understanding how much that piece of their culture is part of like their whole life. And like if you give them the right information, you could really save their lives in the long run and prevent a whole host of medical issues.
Yeah, for sure. What would anyone can answer this, would y'all say that healthcare providers could really improve on right now to be able to help fill the gaps and between good education and connecting with culture?
I'd say language to begin with, but not language as in Spanish, English, or Arabic. I mean language as in emotional language, like motivating our patients to look for information in different places and safe spaces is perhaps the most interesting part of our daily work as a clinician, that we have to guide them to look for this information in a safe way and then debate that information with them. And also making sure that we understand their needs, because most of the times, and we've seen this as patients ourselves, we go to see a nutritionist. This was my personal experience, for example. I went to see a nutritionist, and don't get me wrong, I received an amazing meal plan that included foods that I didn't know and that I didn't feel related to. So maybe if she had taken more time debating and talking to me, she'd understand that probably on Sundays, it's important for me to have certain foods after going to church, just to put an example. And maybe just understanding a bit about my culture and my needs and my personal feelings and emotions through all my management would give a different and new perspective. So making sure that we hear, listen our patients and understand their backgrounds and making sure that we are addressing their specific needs. This is my debate with diabetes education. Diabetes education does not mean having a group of people sitting in a classroom. It's making sure that we are providing tools for them to develop expertise and being able to take better decisions in terms of diabetes management per se. So these are the things that would come to mind for me, and as per my personal experience, of course.
Yeah. Mariana, could you talk a little bit more about what the current situation in diabetes education is in Latin America?
Most of our countries do not have access to the very basic tools. We do not have access to insulin, for example. We are actually working and advocating for that to happen, but it is not a reality in most of our countries. So you would understand that diabetes education is also not a thing that is mostly and commonly provided. We have to become our own advocates and our own diabetes educators. This means that it is mostly peers and people with diabetes who are giving diabetes education to others. There are big organizations, of course, but these organizations cannot make sure to fulfill everyone's needs. So we have to work stronger. And building access and building bridges among people is perhaps the way that we are going to get this diabetes education to them all. And in this case, most people in most countries, not all of them, because as Anna just said, each country and each population has different needs and characteristics. And most of them do have access to internet, yet not everyone. But most of them do have access to internet. So we're beginning to provide some very basic information that they can share, but that's not actually educated, it's just providing information. So we have to make sure that this information provided, this basic information, turns and converts to diabetes education. And we are working to address that, but it'll take a while still.
Yeah, for sure. Thierry, could you talk a little bit more about how to kind of decipher between, you know, a credible resource and not so credible resources?
Yeah, so if you're using the internet, there are so many articles that can confirm your own biases. So it's really important to make sure that you're keeping up with the research. So Google Scholar is free, and you can adjust your search to look at your from the most recent date of that publication to as far back as you need to. And keep an eye out for like the last 3 letters in a search engine. So I go by .edu or .gov, sometimes .org, but it really depends on the nonprofit organization. So ADCES, ADA, JDRF, and other nonprofit organizations generally have their information medically verified. But even then, if you wanted to, let's say, throw another one like Health On is another good one that people refer to. Make sure that it's medically verified by someone, and you can even go and take it a step further and look up their credentials to make sure that they are someone who is reputable. I think PubMed is another one, is something that I use a lot. I've used a lot that in school as well as professionally, because I can get a lot of the gist of current research. I mean, I have access to the full study, but just reading the abstract, I can see what question was asked and what results that they found, and I can read it in layman's terms too, so it's easier to understand.
For sure. I think the layman's term is so important as well. There's so much information out there that feels like it's kind of textbook language. And I mean, diabetes is not a textbook disease at all. So yeah, it's so important.
Oh wait, I'm sorry. And there are also like, so one that I think a lot of people are on like YouTube now. So also you can find like Khan Academy is another really good resource I really like, because those are people who are educators. They might not be diabetes educators, but these are people who are teachers and they know how to break down scientific information that's really easy and digestible.
Okay, that's interesting. Anna, what's been the kind of go-to resources that you've found out there?
So we have, through my connections at Diabetes Sisters, we have a great relationship with the Association of Diabetes Care and Education Specialists, the former AADE. There are so many great diabetes education, care and education specialists out there that cater to, minority groups, that have a passion for helping people in underserved populations, in areas where healthcare is not always a priority, and they're really sort of this great gateway for people with diabetes and people of color with diabetes to sort of start to learn about diabetes. And you said before that diabetes is not a textbook disease. It's not. It's an educational disease, right? Because from the moment that we're diagnosed, we're learning, right? And as things happen in our lives, we adjust that learning, and technology changes and treatments change, and our lives change, and so we're constantly learning how to work with our diabetes, right? So I love the diabetes care and education specialists just because of the work that they do. They're always trying to advance what they know. I met a diabetes care and education specialist who shared with me, we were talking about Ramadan. And she shared with me that although she's not Muslim, she fasts every Ramadan because she had Muslim patients. And so she needed to best understand what they were going through when it came to injecting insulin or taking oral medications and the effect that fasting had on diabetes. And to me that says a world of things, right? That just says, look how interested this specialist is in her patients, that she would go through 30 days of fasting, and eating, only at sundown and before sunrise, so that she could better understand and serve PAs that have worn pumps. They don't have diabetes, that have worn pumps, so that they could understand how to loop through the pump, how to understand how to put on an infusion set, how to take it off, how to dose, so that when they explained it to me, it made perfect sense to them. And those are the kinds of educators and the healthcare providers that you want to get with, the ones that are in those trenches with you, right? So that when you walk in, they're already on the same level as you because they've experienced life with diabetes, whether or not they have it.
Yeah, I think that's so important because, I mean, like you said, that shows that they're willing to put themselves in, their patient's shoes. And that's going to also help with the tone of how they kind of deliver things, because they have a little bit more of an understanding. And it's not just, oh, I'm going to read off this list of things that you need to do. It's, oh, I understand that, so I'm going to be a little bit more compassionate. So I mean, that's so important to be able to have healthcare providers who want to take that extra step for us.
And a great way to understand that is through our peers, right? Meeting other people with diabetes and saying, hey, like my healthcare provider does this, is that normal? And we were talking before about empowerment. And once we're empowered, we know what good healthcare is and what not so good healthcare is. And we can go back as peers and say, like, no way, don't settle for that, right? Your health is more important than settling for an 8-minute appointment where the healthcare provider doesn't even look up from their computer or from your file, right? So certainly always use those peers to get some information, just to gather it, so that then you can make really, really mindful and educated decisions about your care.
Yeah.
Can I just hop on something that the Anna just said just now? And this actually goes back to what you asked Mariana about what health providers can do. Look at your patients. Like, I can't tell you how many times I've had a doctor like just sit at the computer and like enter my information and just ask me questions, and I'm just sitting there on my phone or just swinging my feet looking at the posters that have all the scary information on it, but there's no it's not personable. I feel like I'm just another cog in the wheel, get in, get out, going about my day. But and it's so much bigger than that. And we talk about people of color living with diabetes, but we have to think about just people of color in general and like some of the disparities that we're already facing. So before I moved out to California and had the job I have now, I had to take off work to go get my diabetes checkups. And because I took off work, that means that's money I'm losing out of my paycheck. That's gas I'm spending to go to a 10-minute appointment, 20 of which I'm waiting to go see the doctor, only to be told like maybe one or two things, then say, hey, okay, here's your lab work, go to LabCorp, bye. But nothing after that. I may get a pamphlet or two, but no real education. So being conscious of the reasons why your patient is there, like even if you only have 10 minutes, if you spend 5 of those 10 minutes asking your patient, hey, how are you? Can you talk to me about just one thing about your diabetes care that you're having issues with? That can go such a long way. You can even start off your appointment by asking like, okay, just tell me what's up. I have to enter in some things on my computer, but I can do that towards the end of the appointment, but I want to hear what's going on with you. Because chances are your patient isn't telling you everything. And the reason why they're not telling you everything is because they can't trust you. I'm just gonna like say something here, but I know I've been going through something with my own diabetes now. And the first person I told was my diabetes care and education specialist. I text her all the time. Even this morning, I was texting her my Libre numbers because we have that kind of relationship where I can feel like, hey, I'm actually doing really good. I'm doing really bad. And she'll say, we got this. But I couldn't do that for the first, I've ever been a patient, even before I had diabetes. So listen to your patients because they are there because they need your help. They're not just like another number. And I know it's because primary care physicians in particular, they don't always have a lot of time. And I think that's more like a systematic thing, but I think we could all just do a little bit better by just taking a few minutes out of the appointment to just inquire about the quality of life your patient is having.
Yeah, and I'd like to add to that, Tiara, like what you're saying, it's very, very cultural. So as Hispanics, as Latinos, we love to talk, right? And we love to share, but we don't love to talk and we don't love to share with our physicians, right? Because we want them to think that we're doing everything right, and we don't want to bother them. At least culturally, like we don't want to bother them. Oh, they're so busy. Their job is to take care of us, and if they ask us questions and they're a little bit more pressing, we'll tell them much, much more, So ask questions and really approach us as people, because more often than not, we're thinking, and our health is not always the top thing. That's a cultural thing as well, right? We're thinking about our families, we're thinking about our spouses, we're thinking about our parents, we're thinking about our kids, and that's a fault, right? But healthcare providers can see that, and they should know that if they're approaching us and knowing that we're of a different culture.
It's also perhaps a matter of understanding our priorities, as you just said. It's like I've had patients with me who do not understand how diabetes management in terms of meal plan should be always, but because they have these rituals and festivities and others that include also food, but is as an emotional aspect of their daily life. So perhaps just talking to families and understanding their needs and their feelings especially would make a whole big difference. Just like understanding the background, the way they use different foods do not have to do, is not only related to access or to not having enough time. It's mostly related to culture, the way we eat, the way we dance, the way we behave, the way we speak. So perhaps understanding those differences, inviting, let's say, community leaders to your office every once in a while to see what the community needs as a community, as a whole, as in a bigger picture. Like inviting, for example, I don't know about you, Ana, in Cuba, but at least us Mexicans, we do trust our abuelas just for everything. So if my abuela decides to have us come for dinner, it doesn't matter if I live with diabetes or not, I'm gonna have that dish, yes or yes. So why not teaching me how to use those dishes in a wiser way, in a more intelligent way, and give me all the strategies to keep and to add diabetes to the life that I already had, instead of just like rebuilding my meal plan and rebuilding my day and rebuilding my schemes and my culture, because that's not gonna work. And making it not all about diabetes, but about the individual, and having diabetes just as a part of a very big individual full of differences and full of colorful things. Just like a very small, tiny part of the individual is diabetes, I'd say.
Yes. Yeah, I think that for all three of us, you know, our culture is very important to us, and it's very important to honor that culture, right? And that doesn't always go in agreement with diabetes and diabetes management. And so, yes, it's very, very important to learn to incorporate diabetes into our culture so that we can continue to respect our culture and pass it down. You know, so that we don't have to say no to our abuelas or to our mothers, right? Who have these notions about how health is, right? About how food is, about how religion is, but how do we incorporate that so that it still works, right? But also how so that we can still make, you know, I think we have that too.
And like, I think, you know, for within the healthcare professionals industry, like there aren't a lot of minority ones who we can probably identify with. So for primary care physicians or whomever are working with patients of different cultures, even if you don't know that culture, like it would just be helpful to know a place or resource where you can point your patients to, because I mean, we don't expect, you know, doctors to know every single thing about us, which is fine, but part of that competency is knowing where to point your patients to. I did a lot of work in Baltimore in community outreach. So, but back then, like our population was mainly like seniors or people who were on Medicaid, and for primary care physicians who didn't know what else to do for their patients who couldn't afford their medications, they sent them to us, and we talked to those people at our tables and gave them resources on what can you do if you can't afford your medications. And I think like finance is also part of that sort of cultural thing that probably the three of us can relate to. Like money is such a sensitive topic, and we are very proud in being able to care for our own, especially ourselves. So if you're talking to a patient and if you notice that they're not taking their medication, you shouldn't be saying like, well, you need to take your medication. Well, duh, like everyone knows that, but you should ask why, what's going on? How can I help? And even if they don't feel comfortable telling their own families, you really have to make that a safe space where they can talk to you about that.
Yeah, and that's what our endos and our healthcare providers should be, as our safe space. Like they're there to take care of us. So we should have this very safe space where we know that, okay, I can go to them and I can get this information that I need. Where have y'all been able to find, you know, resources that the healthcare providers should be answering, but you've kind of had to figure that out on your own? Mariana, what has been like one resource that like you really wish your healthcare provider gave you, but you found it on your own?
First of all, the diabetes online community. It was years ago that I decided to take a look at the internet, because that wasn't something that us Mexicans would do that oftenly, because there was no access to internet as it was here in the United States. And I suddenly found the diabetes online community, and they were talking in English, and they were sharing information among themselves. And I just started like figuring out the topics and the information that I needed. And I thought that it would be an amazing place to visit every once in a while. And then I learned that there were some tweet chats, and I started following those tweet chats. And I saw that community growing, and I saw them talking about access and advocacy, and we were learning at the same time and just trying to rebuild all that expertise and taking it to our own countries. So that was perhaps my first encounter with diabetes education and online sources. And then it was ADE, whose name has changed, and I cannot say that name correctly, but they do have a very good list of Spanish resources in their website. And I wish that those were the resources that were prescribed and recommended to our peers, because that's a very strong list, and it's a verified list by health professionals. And it's a couple of resources that people should take a look and analyze and share among themselves. And as I've said before, community. If you want to work with people who speak Espanol and come from different places in Latin America, have them come to your office. Why not having Spanish-speaking researchers, Spanish-speaking teachers, Spanish-speaking diabetes educators, and making them part of a community that would eventually help other people. So if you want to work with us, you should first talk to us and see what are our different needs and make sure that we can help you. We could work as a team and probably just figure out better ways to support our people and communities.
Yeah, and I'd love to add to that, Mariana, because I think that that's excellent. But I think another area that we're lacking in is research in our populations, right? So to have clinical trial experts come and talk about clinical specific to our groups and our ethnicities and our cultures can really, really help. And then for our healthcare providers to learn those things, and then they can say, well, these are the studies for people like you, right? People that look like you, that speak like you, that speak your language, that have the same experiences as you. Those are really important, and that we're getting there, but we're not completely there yet, right? They might have a hard time with it too. But they have really worked a lot with the DOC and patient advocates to put together some really excellent, reputable resources, right? That come from organizations that are vetted, organizations that work in conjunction with professional organizations, that work with ADA, that work with JDRF, that work with DCES, also that work with like the Association of Family Practitioners, Nurses Associations, and all of those kinds of things. And that's really, really important because that provides credibility to the patient voice as well. So that if you're looking online for resources, then that they're vetted because they're vetted by these professional organizations that include endocrinologists and nurses and education, care and education specialists, and so on and so forth, and even psychologists. That speaks volumes as to how far our communities can go in receiving the care that they need.
And also so something that Anna, you talking about research just made me think about representation at conferences too. Conferences are so expensive. And when I went to my first ADA last year in San Francisco, and one thing that I noticed was it was super white. And it was very I didn't see a lot of people who looked like me, not just women, but just in general. And I was thinking about the community health workers who could be here, talking about the issues that people with diabetes face, and also providing their own resources at booths and whatnot. I think there's a lot of great innovation within the diabetes industry, but what we need to know more about is how are the basic tools and treatments impacting minority communities, and having that representation there is really important. And also when it comes to research, there's a lot of distrust, particularly within the Black community, when it comes to medical research, kind of going back to the Tuskegee experiments. So having someone who looks like that group is so important. So because there's that trust that needs to be there. I'll kind of throw COVID out here real quick, but there's a lot of discussion about the COVID vaccine. And I know in my circles, people are nah, I don't want to be the first one because I don't know what's in that vaccine. And I don't trust healthcare providers to listen to me, are having our voices heard within hospital systems and healthcare in general. So that kind of representation, just like in research and just having us present at different conferences, is just super important and could be critical.
Able to touch on a lot of different things. Is there anything else that y'all would like to add onto resources and what's really helped you guys with y'all's own diabetes management?
Yeah, maybe just inviting people to reach out to our organizations and all of the other organizations, and especially the diabetes online community. Even when it's basically in English, there is a small growing group of people who also speak and write Espanol. So it would be amazing for us to work as a team, because no matter where we are or the language that we speak, diabetes is still diabetes. And we can also share recipes even when we eat differently and behave differently and have different cultures and celebrations and others. We can still work as a team, and we would go más lejos and more stronger. So perhaps building better if we work as a team.
Yeah, and also like bring your family and friends into these conversations too. If there's one thing that, I think the three of us have in common, it's just like our family means so much to us, and we want them to be we want them to be part of our care, and our family wants to support us, but they may not know how. So it's these same resources where you're learning about your diabetes, send it to them too, even if it's just like a couple of pages you thought were interesting, to help them kind of see what your life is like.
Sure, and I'd love to add, so on the Diabetes Sisters webpage, all of the educational resources that we have developed over time, we have translated probably about 80% of that into Spanish, into very, very understandable, clear, language, right? Not too medical, general information about diabetes, about pregnancy with diabetes, about gastroparesis, so we have some things that are very topic related specific, but they're very easy to understand and very easy to share, and they're free. So all you have to do is either forward it or print it, so use those. That's why we develop them in conjunction with professionals, right? So we talk about mental health and diabetes, right? Which is something that we didn't talk about today, but is sometimes very taboo in our cultures to talk about mental health altogether. So we have some conversations there about anxiety and depression with diabetes and how that can take a toll not just on us, but on the people that love us. So I would encourage you to go to the Diabetes Sisters website. It's diabetessisters.org, and download the materials in our educational library.
Could y'all go around and say where they can find y'all online? Mariana, do you want to go ahead and start?
Sure. You can find me in Beyond Type 2 in Espanol and Beyond Type 1 in Espanol. I actually work with Tiara, and we are the team behind Beyond Type 2. And we are making sure that we have all these access and information to everyone who needs support as well. And you can find me there, for sure.
You can find me at beyondtype2.org. We have a lot of great resources for people with type 2 diabetes, including your family members or friends, loved ones, whomever may be impacted by it as well. You can also find me on cookingtoat.com, which is my personal website where I talk about my health and wellness journey and also about nutrition. And you can catch me on Instagram also at cookingtoat.
Sure. And with Diabetes Sisters, you can find us online at diabetessisters.org, or on any of the social channels. We're on Facebook, Twitter, and Instagram. Our handle is at Diabetes Sisters.
Thank y'all again so much for being a part of this. Our viewers were able to get really good information about different resources, and please reach out to these ladies if y'all do need more information about different things to be able to find online. But thank y'all so much.
Well, thank you.
Thanks for having us on.
Yeah. All right. Be safe, everyone. Be well.